Hi, we are here in Philadelphia for AHA 2023, and I have a privilege to be with Dr. Renato Lopes, needless for introduction, prominent trialist from Duke University, and today they had the results of ARTESiA out. Without further ado, please take it away, Dr. Lopes, and tell us your take about the findings of ARTESiA and its implications.
Well, thank you so much. ARTESiA was an important trial because we tried to answer this question about subclinical AF, those AFs that are detected through implantable devices like pacemakers, ICDs, with a duration of at least 6 minutes but less than 24 hours. And we compare apixaban and a full anticoagulation versus aspirin. And basically what we found is that there was a 37% reduction in the risk of stroke and systemic embolism with apixaban compared to aspirin. More importantly, there was almost a 50% reduction in fatal strokes and disabling strokes, severely disabling strokes, which was very important. 45% of the strokes on aspirin were fatal. So that was a huge treatment effect, confirming the benefit of anticoagulating these patients. Of course, there is no free lunch in this life. We get some more bleeding. We knew we were gonna get more bleeding, but most of the bleedings were easily managed. There were no difference in intracranial hemorrhage. There were no differences in fatal bleeds. As a matter of fact, numerically, there was less intracranial hemorrhage with apixaban than with aspirin, just like we found in the ARTESiA study. And therefore, most of the bleedings were because of dropping hemoglobins and bleedings that were easily managed clinically. So that's why it's not so easy to do a one-to-one comparison, because one needs to take into account the severity of the outcomes to make a decision together with the patients, again, of what might be the best approach for these patients with subclinical AF.
These are such important results. Thank you. And as we were talking about it a minute ago, the results, if anything, are actually aligned with NOAA. And it sounds like you have a plan for individual patient data analysis coming up in near future as well.
Absolutely. The results are, NOAA finished determined the trial order, so they are a little bit underpowered. But when we look at the confidence intervals and when we look at the meta-analysis, basically the conclusion is that the results are exactly aligned. And I think we have now a very clear idea of the treatment effect of anticoagulation in this patient population. And stay tuned for the patient-level meta-analysis, because I think we're going to be able to answer even more questions, including refining the risk stratification around these patients in trying to find who might be the patients who most benefit from the anticoagulation at the lowest risk of bleeding.
Dr. Lopes, congratulations again, and thank you so much for your time.
Thank you.